Hi, everyone, and welcome to the very first training on the Health Services Report, our very first webinar. This is going to be a kind of high-level introduction to the new Health Services Report, the changes that we're making and switching over from the old Health Services database, and kind of a high level of what's different and what you need to be aware of. We're doing a second training on Thursday at 9:30 a.m. DC time, which will cover more in depth the data entry process into the system. So this training is a little bit geared more at a high level for anybody who might be interested in our clinical service reporting and referral reporting on this new system, whereas the second training will be more geared towards data entry staff themselves. So this is intended for a little bit of a broader audience. So with that, we'll get started. As I said, the second training will be this Thursday. So moving into it, the new Health Services Report captures a lot of the same clinical services that were reported in the old Health Services database. Contraception, short-term, long-term, and permanent methods, cervical cancer, HIV testing and counseling, STIs, or I should say tuberculosis and BMMC. The two new service categories that were not previously in the old Health Services database are STIs and maternal health services. So these are brand new things that are captured in the Health Services Report. But a lot of the other data elements are very, very similar to what you're used to reporting in the Health Services database. So what's new? I just talked about some of the new service areas in the new Health Services Report in DHIS2, but also there's new data requirements as well. In the Health Services Report, we now have the capability to collect data by service delivery channel. So things like by franchise provider, by service delivery partner, and PSI direct service provision and reporting services in that way so we can capture them. We also have the capability to provide or capture reported services as referrals. So this is referral to service provision. This was something that we used to collect at the end of every year. LEC would send out a referral spreadsheet to capture all referrals that had been reported in the entire previous year. But this new system allows us to capture referrals on a monthly basis, which is exciting. And there's new disaggregation categories in the system, things broken out by age and gender and location. I just talked about service delivery channels. So different levels of disaggregation that allow for much more robust and powerful analysis to spot trends and help with decision making that weren't previously available in the old Health Services database. So in addition to the system itself and the data requirements that come with the system, there's also a whole new set of resources that have been built around the system to help support it that were not previously available with the old Health Services database. There has been a health area module guide that has been created for every single health area that you saw in the previous slide, which includes guidance on how to report in every single table in the Health Services Report. And so these are really great resources if you have questions about what a certain table is asking for and what should be reported in that. These guides have been developed to help serve that purpose. We also have developed a data dictionary so that every individual data element that's collected in the report, a definition has been provided for that field. So you can access that if you have specific questions about specific data elements within tables and what they mean and what they're asking for. We also have developed a help desk system, a ticket system to support the health services report, which allows you to submit help requests and specify the specific issue you're having, whether you have a question about a certain data element or what you need to be reporting, or maybe you're having some sort of technical issue or difficulties accessing the system. You have the ability to select your ticket type, which will route your request to the appropriate support team member. This does away with a lot of the problems we had in the past of emails getting forwarded 3 or 4 or 5 times when there were questions about the old health services database before they got to the right person to answer your request. So we're hoping that this new help desk system allows people to ask a question and get answers much more quickly from the right people. Another big thing is that there's a lot more support for this system in terms of people that are helping to support the system. We now have regional M&E advisors in 3 of the 5 regions, with more to be more coming soon, and they will be great resources to adjust local data collection tools to report into the new system, local MIS tools, and as well as, you know, they're intimately familiar with this system as well, and they're great resources to ask questions about the system. And there's also the global MIS team, which is expanded, and there are more resources there to ask questions and to help support you in making the transition. So I'm going to do a quick demo of the system. Again, the training on Thursday will cover more of the specifics of data entry, but I just kind of wanted to give you a flavor of the look and feel of the new system, and yeah, give you a sense of what it looks like. So you can access the system at www.psi-mis.org. And you'll come to this screen, and this is where you log into the system. If you haven't yet received an invitation for a username and password to get an account on the system, please send an email to analytics@psi.org, and we will set you up with an account so you are ready to report on June 1st. So I'm going to log into the system here. And the first screen that it'll take you to is what we call the dashboard view. And right now, what you will see when you log into the system, if your country has reported clinical services in 2013 for health impact, you will see a mock dashboard, almost very similar to what you're seeing here, that kind of gives you a sense of the data visualization capabilities of this system. We loaded 2013 data in here just so you guys didn't come into a blank screen, because obviously there's no data that has been entered into your systems yet for your countries, but we wanted to give you a sense of the data visualization capabilities of the system. So just kind of treat this as like a demo view of what can be possible. There are other webinar training videos that I'll show you in a second that you can access to learn more about how to create your own dashboards and visualizations with the system. But yeah, I'll show you guys that in a second. What you guys will probably care the most about is the actual data entry screens, which you can access by going up to the top of the screen here in the apps, and then data entry. So if you click here, you'll see on the left side, there's kind of a tree here. You won't see this entire layout of countries and regions. This is just my level of access because I'm a kind of a high-level administrator of the system. But you should see an organizational tree on the side that reflects your country. And so just make sure that that is selected. I'm just going to use Mozambique as an example here in this training. So for instance, if you're a Mozambique user, you should be able to just see Mozambique on this left side and maybe not the rest of this tree. So make sure your correct organizational unit is selected. That just means your country. And then you click in here and you can see that there's different data sets based on what you can report into the system. And each data set is its kind of own set of data entry screens within it. So we only expect you to report data into the modules where you actually are providing services. You don't need to go through every table and enter zeros or things like that. We actually actively encourage people to not go through and enter zeros into the system because it would be very time consuming. So just focus on the things that you know that your country is providing. So let's say that you are running a HIV testing and counseling program. So you would click to report in there. And then you may want to report for the April 2015 reporting period. And you'll see that you can select the month of your reporting in the period field here. The period cycle runs the same exact period as the old health services database did. The system opens on the 1st and closes on the 12th of each month, and then cannot be reopened. So if you happen to miss a reporting deadline, then you just add your data to the next reporting cycle. So if you click into here, you'll see what the data entry screens look like. And again, I'll be talking a lot more about the specifics of this in the next training, but you'll see that there's a set of tabs across the top here that reflect different things that you may need to report on for HIV counseling and testing. So for instance, the first tab here, you have total individuals tested for HIV, both as individuals and here broken out in couples, and then you have the age and gender disaggregations here as well, and also in an unknown category. And then if you go over here, you'll see that it's HIV positive results by individual and couples, couples by service delivery channel and seropositivity, testing location and residence, client history, CD4 testing, and then tabs to report referrals. So you have tabs to report issued referrals and confirmed referrals in the system. So this gives you kind of a sense of the look and feel. I'll be going into each module in greater detail in the next training, but this is kind of the structure of each data entry screen. There are a set of tabs to reflect the different areas of data entry that you can click into, and then there's usually 1 or 2 tables within those tabs. We've created these tabs so you don't have one giant long running sheet in one area. You can kind of click into what's relevant to you and what you are set up to report. We encourage you in any module that you're reporting into to click into all the fields and make sure, or all the tabs, and make sure that you're reporting into all the tables. And if you have any questions about, our reporting systems are not set up to report this way, that's going to be very common, especially in the early going. But to reach out to your regional M&E advisors to talk about adapting local data systems to help fit some of these new requirements. So there's a few resources within here that I'd like to talk about. First of all, there's the help desk. On every single tab within the health services report and module, there's a little button here for ask a question, or if you have a problem, ask here. And so you can click into here, and this will take you to our help desk. And what you can do is enter your email address, your name, country, give some sort of subject to your request, and then also pick a ticket type. This is kind of what I was speaking to earlier about if you're having technical issues with the system, if you're having questions about a specific health area reporting, if you have questions about health impact, reporting referrals, or if you have questions about, we don't report our data this way, how can we do that? There's also a button to click there. So you can select your ticket type, write a description of the problem that you're having. You can even attach a file or some sort of screenshot here to show us exactly what you're looking at, just enter this code and hit submit, and then it'll be routed to the right person to answer your question. So that's the help desk that you can access from any point in the health services report by just clicking here. There's also a data dictionary that if you click here, it gives you the data elements that are specific to the table that you're looking at right now. So right now we're looking at HIV positive results, disaggregated by individuals tested and couples tested, as well as gender and age. So if you click into the data dictionary, you'll see that those two data elements are represented here. And what you can do is you can just click into this description, and it'll break down exactly all the different things that these data elements are collecting. So this is a great resource if you have very specific questions about specific data elements, to click into the data dictionary and try to get a better sense from the descriptions about what each data element is asking for. So that's the data dictionary. This is available for all the modules of the report, so you can click in here depending on what exactly you're interested in finding out more about, or you can move around in the different tabs here and then click into the data dictionary again, and it'll retailor itself for the table that you're looking at if you have questions about that. So we really, really encourage you guys to use these resources as you're having questions. The other important resource is our knowledge base, which is also tied to our help desk, and you can access that by going to support.psimis.org, and this brings you to the help desk. And on the top here, you'll see some DHIS2 technical configuration updates, but what will be most relevant for you is this knowledge base here, where you can access the health services report module guides that I was previously talking about. If you click in here, you'll notice that for every single module in the health services report, there's a corresponding module guide here, which explains each module in detail. So it'll explain a little bit about the health area itself, why we are collecting this data, like why is it important to collect, and then it walks you through tab by tab, table by table to explain each aspect of the module. So these are really great resources. Again, I really encourage all of you, before you start reporting, and once you figure out which modules you're going to be reporting into for health services, to take a look at these module guides for each one of those areas and read them through thoroughly, and really get a sense of what these tables are asking for. And I think it's really helpful too to just go through the tables, and then as you look at them, flip back over to the module guide and read the description to get a really firm sense of what the requirements are. So that's one aspect of the knowledge base. We have all these module guides for each module. We also have a list of common definitions in the report. So this is kind of a condensed version of the data dictionary. If you have specific questions about a certain health area and the definitions around those, around certain terms, then this is a great kind of quick snapshot of some of those frequently asked questions around definitions for each health area. So we have the common definitions. We also have an archive of communications that have gone out around the health services report. We'll be updating these with current information, the things that you've seen sent out, in terms of like what is the new health services report, like communications like these. You can find these here, so you don't have to dig back through your emails to find them if you have questions. And then finally, we also have a log of training videos. So we have this webinar here that I'm recording right now for you guys to access, which will be posted on the MIS YouTube channel. But we also have a set of much smaller videos which walk you through all the basics. There's 7 videos of kind of each aspect of the health services report, and they're very short, between 5 and 10-minute videos that cover these core concepts. So we also encourage you to check these out before you do data entry, if you don't want to watch an entire webinar, or if you just have questions about a specific area. So if you click into here, you can see you can follow the link, and you're brought to the MIS YouTube channel. If you actually click on the channel itself, either here or here, you'll see that beyond just the videos that are listed here, we also have recorded webinars, so you can rewatch this training and other trainings that we've done in the past here. These are obviously a little bit longer and may take longer to load, but they are archived here if you would like to access them. Okay, so that is a quick introduction to the system itself and the resources that are available to you if you have questions on the knowledge base. Again, support.psi-mis.org is your best friend for all the questions and resources that we have available. Again, if you don't find what you need here, definitely come up here to submit a request, and this will take you to the help desk ticket system, and you can send that through to us. So a little bit of background about why we're switching to DHIS2 versus the old health services database. First of all, this is a much better, more robust system. The old health services database has been around for quite some time now, and it's really difficult to change and customize. It was a custom-built piece of software that was quite difficult to change and expensive to change. So we're moving to a platform that is open source in DHIS2 and quite customizable, so we can continue to tailor it to meet our own requirements. And it's a much more powerful system. You got a sense of that with the dashboards that you saw. There's pivot tables and an analysis app within that you can really manipulate the data in a lot of different ways that the old health services database did not allow. And DHIS2 is rapidly being adopted as an MIS solution for many country Ministry of Health systems, and as well as donor systems, PEPFAR and USAID, to name a few. So this is kind of, I guess, the future of MIS, I guess. So that's a big reason why we're doing it, but also our commitment to strengthening our monitoring systems. This is a big part of the mid-cycle strategic plan revision, the Lead with Evidence initiative, and strengthening monitoring systems. And it's a huge area of importance for us to strengthen these systems and allow us to collect data in more meaningful, regular ways. And this allows us to set better the system allows us to set better global standards for clinical services reporting. With the data that we're collecting with this system, we're going to have better insights into our programs, be able to tell better stories at the global level about the clinical services that PSI is providing in our franchises and with our partners, and also through the referrals that we're providing and the linkages to care that we're facilitating from different levels of the service delivery. So that it's really powerful for us in that way. And more importantly, our competitors are collecting a lot of this data already, and we're being asked more and more to be able to collect information on different types of disaggregations that the old health services database did not allow. So this allows us to remain competitive against those other organizations, and but also strengthen our own systems internally and help with evidence-based decision making and advocacy around that. So to conclude, what what are some key bits of information that you need to know about the system? The biggest thing right now is to continue to report in the old health services database for June and July. Even though we're starting with the health services report and DHIS2 in June 1st as well. This is because while we're in the process of getting everybody online, we want to make sure that your health impact data from the old system is not lost during these months during the transition. So all health impact data will remain collected from the old health services database in June and July. So we're asking you to double report into both systems for those months. With the goal of transitioning everyone fully onto the health services report only in August or September, depending on how fast everyone gets up to speed and is reporting accurately and completely into the new system. Another important piece of information is that for the first time, we are collecting referral and short-term method service provisions in the health services report. This was something that we didn't collect on a monthly basis before. What will be new in the new system, but because again we are only collecting health impact data from the old health services database in June and July, this reporting will kind of be for these two things, for referrals and short-term methods. Will be in kind of a testing mode for June and July as you're reporting them in the health services report. We really encourage you to report these two bits of information in the health services report during the testing phase to really get a sense of what those fields are like. But then in August, when we're on the system fully live, we will ask you to report all of your referrals and short-term methods from all of the months leading up to either August or September into the system on that first live month. So we'll have more guidance about referrals and short-term methods specifically in the next few months as we transition. But just know that we would like you to report into both systems in June and July. The other big thing, as I've been saying, is to familiarize yourself with the knowledge-based resources that are there. There's quite a bit in terms of the module guides and the training videos and the webinars. Definitely use the resources that are there. That's why we're trying to help create them. So to help ease this transition and become familiar with the help desk system. So if you do have questions, that you can send them to us, and we can try to respond to those as quickly as possible. And again, rely on your regional M&E advisors if they're available, and I believe that they're in place in West and Central Africa, East Africa, and Asia and Eastern Europe, and in Southern Africa there is NOAA as well. So there are resources there. So if you do have questions, please reach out to them. And that's more or less it. Again, if you have any questions about this video or anything that I discussed, please shoot us a help desk ticket. Yeah, we look forward to see your reporting on June 1st, and for those data entry folks, we really encourage you to attend the 9:30 DC time training on Thursday, May 28th, to learn more about data entry into the system. Thanks a lot.